Hello tribe, Dr. Sarah here for another video. As you can see, I'm outside today. The weather's not the best, but still better than being inside out in the sunlight. So I had a few people reach out and ask me to do a video on insulin resistance and basically what some of the signs might be if someone was insulin resistant. So the term gets thrown around quite a lot, and I know like there are lots of people that talk about it. But for those that don't know, insulin is a hormone. It's produced by your pancreatic cells. They're called the beta cells in your pancreas, and they're produced in response to predominantly eating carbohydrates that get converted to glucose in the blood. There are other things that can stimulate insulin as well, which I'll go through maybe another time. But for this video, we're just going to talk about insulin resistance. So basically, over time, what can happen is if you're producing too much insulin and too high for too long a period, your cells will stop becoming responsive to it. So normally insulin rises up after you have, say, a glucose meal or something with a lot of carbs. It rises up because basically at any one point in time, your entire blood volume can only hold the equivalent of just under 1 teaspoon of glucose in it. Anything more than that is actually potentially quite toxic to the body. So insulin is there to basically drive that glucose back down and drive it into cells. Now, generally, you would sort of hope that the cells might oxidize and use that glucose, but in most people's cases, it tends to get stored either as glycogen in the liver, or for those of us that don't really like it and no one likes it, is the unsightly fat storages. Okay, so insulin is what we call a lipogenic hormone, which means it very much likes to form fat. So anytime your insulin is high, you are not going to be in a fat burning mode. Okay, so for people that struggle to lose weight, that could be one of the reasons why, is if you are constantly having a high insulin level. So normally insulin rises up, goes down, will rise up, will go down. Now over time, what can happen is if insulin starts to become less and less effective with the cells, then you need more and more insulin to have the same effect, okay? And so you get what we call hyperinsulinemia, so too much insulin in the blood. And then this is the precursor to type 2 diabetes, okay? So some of the symptoms that you might be insulin resistant, I've written them down here, so I'm going to defer to them because there was quite a lot. Okay, so the first one, if you tend to store fat around your tummy mostly, so if that's the area that you tend to struggle to lose weight with, so you look at your waist to hip ratio, that's usually a pretty good indicator that there's something might be going on with the insulin resistance, and that tends to indicate a fatty liver. So if you haven't had any blood tests done or liver tests done, that could indicate it. Just remember too, guys, this is not medical advice. I'm not giving you specific or general medical advice. This is just some educational information. Okay, if you need specific advice, speak to your doctor, your awesome doctor who will look after you, but this is just some general info. Okay, so that's the first one. If you're getting lots of sugar cravings, okay, now there can be lots of reasons for sugar cravings, but if you're finding throughout the day that you tend to be getting the munchies, particularly if you're like, chippies, and you want those high carb snacks throughout the day, that will tend to also indicate that you may have some insulin resistance, yeah, because basically your glucose is going high, insulin is coming in too high, it's dumping the glucose down, then your body goes, oh my God, I need more glucose, I need more carbs, okay? So that will tend to also be an indicator that you may have some insulin resistance. If you have had a blood test and you have increased fasting glucose, that is usually an indicator that you may potentially have insulin resistance, okay? Depending on if you're taking some other medications or things, but generally increased fasting glucose would be something that you'd want to investigate further. If you have an issue with acne or problems with your skin and breakouts, that can also be an indicator. The reason being that insulin resistance can actually lead to alterations in testosterone an increased testosterone production in women, in particular. And this then also ties into issues with things like PCOS. And also, so increased hair, like if you're getting facial hair and things like that as a woman, that's commonly associated with things like PCOS, which is also very much associated with insulin resistance too. So just something to be aware about if you're struggling with acne and maybe too much facial hair where you don't want it. Sometimes that's just genetic with facial hair, but if it's something that's sort of come on and you've noticed it as a change, that might be an indicator it could be insulin resistance, okay? Also, so hair loss for women as well. So if you start losing hair, again, that can be related to the sex steroid hormones and the changes around insulin affecting that, okay? Skin tags are another thing. So if you start noticing those little like tags on your skin, they look like little, pimples that like stalks that hang out from your skin. That can be another indication. Darkening of the skin areas around like creases, so at the back of the neck, basically like in the groin, where you have skin creases. If you start to notice darkening in that areas, it's a long name called acanthosis nigrans, which basically means darkening of the skin in that area. So again, could be another indication. Not always, but what I'm saying is if you have a whole list of these things together, maybe start to kind of put the two and two together and go, I may have some issues here. Okay. Cool. What else? So if you have an increased blood pressure, that obviously get checked with a doctor. If it's something that you have, and it's an issue for you, because that often can, so insulin resistance can often lead to high blood pressure as well. If you if you're retaining weight a little bit too, so fluid retention can be from lots of different things, but one thing we do know insulin does is it tells us the tubules in the kidney to hold on to salt, okay? So you'll have some water retention. That's one of the reasons too why people, when they tend to drop carbs really quickly, will tend to drop a huge amount of water because the insulin has dropped, okay? Sorry, it's my dogs just going off at each other. Okay, cool. And then the other thing, okay, so if you get really tired after meals, so basically if you have like a carby meal and then say, like the typical afternoon slump for a lot of people around that 3-4 p.m. and then they're like, oh my gosh, I just need something, I need a snack, and you get that brain fog, and then you're like, I just can't focus without like a bag of chips or a muffin or a cookie or something. That's also a pretty good indication that kind of your insulin is doing this dive and your glucose levels are doing this all day, okay? So they're just some little things you can maybe have a think about if it's something that's affecting you. You might always go to a doctor, get it checked out. If you have some of those symptoms, they might be due to something else completely, okay? But if you have all of those symptoms together, maybe it's a pretty good sort of indicator. But definitely if weight is something that you're struggling with too, particularly around the abdomen, it's a pretty good indicator. And look, insulin resistance in the States, like they estimate 1 in 3 people are insulin resistant. I'm pretty sure the stats would be similar here in Australia. So odds are that some of you might be. And it's something that you may want to address, okay? Anyway, I just thought I'd share that with you. So thanks for listening. No props, no toys today, but I promise next time I will have some props and toys to explain things with. But I thought the background and the beautiful ambience here was enough. Okay. All right. Thanks, guys. Talk soon. Bye.